Hello friends, I am Dr. Sneha Nikte, consultant physician and a diabetologist practicing in Chembur, Mumbai. In our series of understanding more about diabetes, today I will be talking about complications of diabetes. As we all know, diabetes is a very dreadful disorder which comes with n number of complications. These complications can be further divided into acute complications, which are the complications happening at a very rapid rate if the sugars are not kept under control. And there are chronic complications which happen because of long standing duration of diabetes. Let us see what are the acute complications of diabetes. The acute complications of diabetes ranging from type 1 diabetes to type 2 diabetes are different. To name some of them, there are a hyperosmolar hyperketotic state, which is very common in type 2 diabetic patients, where the sugars may range above 400, 500, at times even 800 up to sugars are seen in HHS. Apart from that, there is a condition called as diabetic ketoacidosis or DKA, or also called as diabetic coma. This condition is very prevalent in our type 1 diabetes patients. This condition is present with lot of metabolic challenges, and the patient is to be treated in the ICU setup with right amount of insulin and IV fluids. It is also a very harmful condition for the patient if not treated well in time. Apart from that, severe hypoglycemia or low sugar level is an acute complication of diabetes. Sugar which is present less than adequate range or less than normal range can also pose as a major threat to life. These patients who have sugars ranging from 40, 50, 60 or even lesser than that at times, the sugar can go low because of various reasons. The first reason would be taking double dose, or second reason could be taking dosages of insulin more than advised. So these patients may get hypoglycemia. Let us see what are the chronic complications. The chronic complications can be microvascular complications or macrovascular complications. Microvascular complications would be those complications affecting eyes of our diabetic patients, called as diabetic retinopathy. Another microvascular complication would be retinopathy, then nephropathy, where the kidneys are affected because of long-standing diabetes. There can be neuropathy. Diabetic neuropathy is a condition where the feet and palms and feet of our diabetic patients get affected because of long-standing diabetes and very high sugars. Macrovascular complications affect the organs like heart, brain, then your legs and feet, and these are very harmful in the long range. So these are the complications. For a better understanding of diabetes, stay tuned to our diabetes series. Follow up for further videos. I will be talking about the treatment of diabetes in our upcoming videos. Wishing you all a very happy and healthy time ahead. Thank you so much. 2.1